you know, for those who are just starting their career in healthcare during the pandemic, they found that this situation that we've been experiencing the last couple of months really threw their career into high gear.
And that's exactly what it did for Gage Harris. Our Sarah Jones takes us behind the mask tonight of a local phlebotomist.
Early on in the pandemic, hospitals began opening COVID-19 units.
Towards the beginning of the unit opening up, it was only nurses over there, and they were kind of having difficulty getting blood from patients that weren't just being drawn from PICC lines or central lines and things like that. And so they were talking about putting a phlebotomist over there, and so I told my supervisor I'd do it immediately.
At 23,
I got certified a year ago. I had some of the same training in my medical assisting schooling, which I just finished recently.
Just starting his career in healthcare, Gage volunteered to join the COVID-19 unit at the start of the pandemic.
It can be really hard getting blood on a patient that's been sitting around in the bed for a long time. They have a lot of things going on, and I know that I have that ability to work with nurses and doctors closely without getting in their way and being able to perform.
He says he knew that if he didn't volunteer, he would regret it.
We wear respirators with the tapper hood. I wear an N95 under that. I wear gloves, and I wear a coat that's patient-specific, so we have coats that hang outside their rooms.
During this pandemic, most hospitals will tell you it's all hands on deck.
I take care of the storeroom, I take care of the coats that we use in each of the rooms, and I just answer the doorbell, and anything that comes up, I just try to take care of it and leave the nurses as free as possible so that they can do their job. I have additional responsibilities working on the COVID unit and than I had before drawing blood. I've done CPR.
The novel virus was unlike anything he'd ever seen before.
The thing that kind of made me take a step back and realize how serious it could be was that they didn't know, one, whether or not, you could become immune to it after you had it, and then also that it could cause, permanent damage in your lungs.
Through this pandemic, Gage has grown closer to the doctors and nurses he works with, as well as the patients.
He was known to be a particular man, and I was the only one who was allowed to poke him, basically, because he didn't like anyone else to do it, and he ended up passing after a long stay. And it was really hard for everyone, but it was rough being there in his final moments.
He says he doesn't see himself as a hero.
My mom's a hero. She's a nurse practitioner, and she went into people's houses to do checkups on patients. She goes completely out of her own environment and really takes their entire health care into her hands.
But as the saying goes, the apple doesn't fall far from the tree.
And Sarah's going to continue to take us behind the mask the rest of this week. In fact, on Friday, you want to tune in for her story. It's about a couple. Both of them work on the front lines. One is respiratory therapist. The other works as a nurse. We do have news now today from the nation's top infectious disease expert, Dr. Anthony Fauci. He now says the malaria drug, hydroxychloroquine, lacks efficacy against COVID-19. During an interview with CNN, he said the scientific data is, quote, really quite evident now. He is the first member of Trump's administration to make such a statement. You might remember the president was taking that drug even though he has not been diagnosed with COVID-19. He did wrap up his treatments earlier this week, and there are a lot of safety concerns about the drug. Today, in fact, moves from the French government. The French government banned using that drug at hospitals. And we did get some interesting guidance out of the CDC today. Perhaps you or your workplace is considering reopening businesses based on the antibody tests of workers. So if you have the antibodies, if you already had COVID, then you can come back to work. Well, today we hear that these tests, the antibody tests, should not be used to make important policy decisions like whether or not people return to work. The CDC fears that the tests might not be accurate enough, especially if the virus isn't prevalent in a community.
Well, the vaccine development company NOVAVAX is now testing its COVID-19 vaccine in humans. It started phase 1 of its clinical trial yesterday. More than 100 people have now volunteered to be tested in Australia. The preliminary results are expected in July. The company's CEO says if this is successful and if it's approved, frontline workers would be the first to get the vaccine. He hopes that'll be available later this year. And a new poll out tonight finds only about half of Americans say they'd get a COVID-19 vaccine. That's surprisingly low. The Associated Press poll found 31% of people were not sure if they would get vaccinated. 49% say they will get the vaccine. 20% say they won't get it. And take a look at this celebration. A baby going home after recovering from COVID-19. That's the child's mother holding the newborn, who is only a month old. This happened in Mumbai, where more than 32,000 people are infected. What a cute baby. Glad that baby is going home.
Hi, Dr. John here with what you need to know about coronavirus today. It's Wednesday, May 27th. Here's the headline: Spreading COVID with no symptoms. Today, new data out of China sheds light on what we're learning about people who get this disease but never show signs of being sick. The study looked at 78 patients who were exposed to the virus from the Wuhan seafood market or from being in close contact with someone who had COVID-19. Compared to patients who exhibited fever, cough, and other symptoms, the 33 patients who had no symptoms tended to be younger, their lungs recovered faster, and they shed the virus for 8 versus 19 days. Your immune system is set up to fight the virus, and you show outward symptoms when your immune system is really fighting hard. This study suggests asymptomatic patients have a milder response to the virus, which could mean less damage to their immune system. But while asymptomatic patients may experience less harm and transmit the virus for a shorter amount of time, it's spreading it unknowingly that puts others at severe risk for illness. That's why we continue to stress how critical it is to have the combination of staying at home, social distancing, and wearing of masks. Now, we're learning more about this virus every minute, so tune in to learn more tonight on NBC Nightly News.
Coming up next,